Today we will be going through USMLE questions on the respiratory system, so let's get started. A 25-year-old man visits a family medicine clinic with a mild cough, nasal congestion, and a low-grade fever for the past 3 days. He has no significant medical history and takes no medications. His vital signs are temperature of 37.5 degrees Celsius, blood pressure of 118/68, pulse of 78 beats per minute, and a respiratory rate of 14 breaths per minute. Physical examination reveals mild maxillary tenderness and pharyngeal erythema with clear lungs and no ear abnormalities. Which of the following is the most appropriate next step in management? When faced with such questions, we should always consider certain key aspects, such as the duration of symptoms to find out if this is an acute or chronic condition, the severity of the symptoms to see if it's a mild, moderate, or severe condition, and the pattern of illness. Has the patient experienced a worsening of symptoms after an initial improvement? We should also focus on risk factors to see if the patient has any history which could predispose them to more severe infections. And also we should focus on the physical examination findings to see if there are signs that suggest complications such as orbital swelling or significant tenderness over the sinuses. By analyzing these factors, we can narrow down the differential diagnosis and determine the most appropriate next step in management. The options provided here are A. Antibiotics, B. CT scan of the sinuses, C. Nasal endoscopy, D. Otolaryngology referral, E. Supportive care. The correct option here would be E, because this patient's mild symptoms and short duration suggest viral sinusitis, and most cases of acute viral sinusitis, they usually resolve on their own and can be managed with supportive care, including hydration, saline nasal irrigation, decongestants, and analgesics to manage discomfort or fever. Let's go through the other options and see why they are incorrect. Option A is incorrect because antibiotics are used to treat bacterial infections, but this patient does not exhibit any classical signs of bacterial sinusitis. Now, bacterial sinusitis is diagnosed when symptoms like purulent nasal discharge, nasal obstruction, and facial pain persist for at least 10 days without improvement, or if symptoms worsen within 10 days after initial improvement. Option B, CT scan of the sinuses, is incorrect because CT scan is typically reserved for cases of chronic or recurrent sinusitis or when patients present with red flags such as periorbital swelling, neurological symptoms, or severe headache suggestive of an extension of infection. Since this patient has a mild and self-limited illness, a CT scan would be unnecessary and would expose him to unnecessary radiation and costs. Option C, nasal endoscopy, is incorrect because nasal endoscopy is used when there is a suspicion of an underlying structural abnormality such as nasal polyps or a mass obstructing the sinuses. It is commonly performed in patients with chronic or recurrent sinusitis, but is not indicated in acute cases like this patient. And option D is incorrect because otolaryngology referral is not required for routine cases of acute sinusitis, and the referral is generally considered for patients with chronic sinusitis and recurrent sinusitis, or when there are suspected complications such as periorbital cellulitis or an intracranial spread. A 2-year-old girl is brought to the emergency department by her father due to sudden onset of coughing. He reports that she was playing with her older sibling when she started coughing persistently. Since then, she has had no fever or other signs of illness, but he has noticed occasional difficulty breathing. On examination, her vital signs are stable except for a respiratory rate of 25 breaths per minute. Lung auscultation reveals decreased breath sounds and wheezing on the right side. She has no significant past medical history. What is the most likely diagnosis? We should always remember that when analyzing pediatric respiratory questions, we should consider 4 factors. Number 1, the onset. Is the condition acute or chronic? Number 2, symptoms. We should focus on what are the key respiratory findings, for example, fever, which would most likely mean that there is an underlying infection. We should focus if there is wheezing, because wheezing could mean it's asthma, bronchiolitis, or an airway obstruction. We should focus if there is a stridor, because stridor indicates an upper airway involvement. Number 3, we should focus on lung examination findings, whether the breath sounds are symmetric or asymmetric. A bilateral wheezing could suggest a diffuse process such as asthma or bronchiolitis, and a unilateral wheezing could suggest an airway obstruction. Number 4, we should focus on the history. Was there any choking episode? Was there any exposure to allergens? Does the patient have any history of recurrent episodes, which would be more consistent with asthma or chronic lung diseases? By systematically analyzing these aspects, we can narrow down our differential diagnosis. The options provided here are A, bronchiolitis, B, croup, C, foreign body in the airway, D, pneumonia, E, asthma. The correct option here would be C, foreign body in the airway. Although there is no mention of a witness intake of a foreign body in the question, it should always be suspected, as a sudden onset of cough accompanied by unilateral chest findings such as wheezing and uneven breath sounds should always suggest the possibility of foreign body aspiration, as incidents of foreign body intake by the children can go unwitnessed. And the right main bronchus is the most common site of obstruction due to its more vertical anatomy. Let's have a look at why the other options are incorrect. Option A, bronchiolitis, is incorrect because the symptoms of bronchiolitis are bilateral wheezing, nasal congestion, cough, and fever. This child in the question has a sudden onset and unilateral wheezing, which is not characteristic of bronchiolitis. Option B, croup, is incorrect because croup is characterized by barking cough, inspiratory stridor, hoarseness, and low-grade fever. Option D, pneumonia, is incorrect because pneumonia, they present with fever, cough, crackles or decreased breath sounds, and not isolated wheezing. However, viral pneumonia may cause wheezing, but it is usually bilateral and it is associated with fever and upper respiratory symptoms. And option E, asthma, is incorrect because asthma, they present with recurrent wheezing episodes, and there should be bilateral wheezing on examination.